Well, when it comes to treatment for those with muscular dystrophy and muscle weakness, there continue to be breakthroughs. Here to talk with us about one of the more recent ones is Dr. Ashraf Hanna, a board-certified physician and director of pain management at the Florida Spine Institute. Now, with him today is patient Terry Stagg and his wife, Barbara. Welcome to you guys, and welcome back, Dr. Hanna, as always. All right, Terry, let's start with you a little bit. Tell me a little bit about muscular dystrophy and the impact that it's really had on your life.
It may have been caused from a serious bout of viral meningitis that I had back in 1983 when I was stationed in Mobile, Alabama with the Coast Guard. The first indications were that I had a problem with foot drop.
Okay.
My muscles in my feet were reacting, and I would walk across a parking lot or through a building, and I would just fall down for no apparent reason at all. It got to the point back in 2004, my daughter got married in New Orleans, and I had a hard time walking around the French Quarter, and then when we went to the church, I had a hard time climbing the stairs to get into the church.
Okay.
I saw some neurologists at the University of South Alabama and a local neurologist down here at St. Anthony's Hospital, and they gave me a biopsy, and I was subsequently diagnosed with muscular dystrophy, specifically inclusion body myositis, which is a permanent, progressive disease for which there's no treatment and no cure. I sought a number of treatments to fight it, and I ended up going to see Dr. Hanna.
And you've made some huge strides right now. So you haven't been able to walk for about 5 years, but you are able to do some new things after this treatment, correct?
Yes, ma'am. For
and
about 5 years.
What can you do? What can you? Why don't you give us a little demonstration? Because I want to make sure we get to Dr. Hanna too, and be able to talk. You are able to move all that. This is brand new for you.
Well, I haven't been able to walk for about 5 years or stand up.
Right.
And I started the treatments back in March, and I could not do that.
Okay.
And I am able to do it now. I have greater flexibility. I can stand, I can walk a few steps.
Right. That is fantastic. That is amazing to be able to see this progress. Now, Dr. Hanna, I want to jump to you a little bit, because we've seen you come on, and the IV ketamine therapy, we've seen it used in fibromyalgia and things like Lyme disease. Where did the idea come from to use it for something like muscular dystrophy?
Okay, well, I want to be clear, I'm not a neurologist,
right.
Okay, and I strongly recommend patients with muscular dystrophy to be evaluated by neurologists and get treated by neurologists first. But unfortunately, the problem is there is no effective treatment for such condition. And anybody who's looking for any treatment out of the box, then I think IV ketamine is a great option. You know, as you know, I've been using ketamine for over 5 years, treating many conditions like CRPS, fibromyalgia, Lyme disease, depression. And then lately, I started using it for some autoimmune conditions like multiple sclerosis, rheumatoid arthritis, and I got great success. And that's really what pushed me to treat Terry. And with Terry, it was a very long haul, because he has been on a wheelchair for 5 years.
Right.
So we did a very aggressive protocol, 4 to 6 weeks, every day, daily infusions with ketamine, aggressive physical therapy, muscle stimulation, and then it was a miracle. It was a breakthrough. This is truly a medical breakthrough. This is the first case in the medical literature about having any improvement in this condition of muscular dystrophy or myositis.
Absolutely amazing. Barbara, we only have seconds left. Just in like 2 words, what is it like seeing your husband be able to do this?
It's amazing.
It is amazing. Wonderful words. You guys can find out more information about Florida Spine by calling the number on your screen or heading online to the website on your screen as well.